Hi, I'm Dr. Tom McGovern. I am a dermatologist specializing in Mohs surgery here at Fort Wayne Dermatology Consultants. I did a fellowship at Yale University and then moved here to Indiana.
We've now done over 29,000 cases of Mohs surgery on residents of Northeast Indiana and the surrounding area.
I and my team members want to make your visit to Fort Wayne Dermatology less mysterious by introducing you to Mohs surgery. Mohs surgery, named after Dr. Frederick Mohs, is simply a method by which we remove your cancer and make sure it's gone. It includes the removal, then making microscope slides so I can check all the edges and bottom of what I removed under a microscope. And after I do that, if there's cancer remaining, I know where it remains on you. Cut out a little bit more, check it again, and once it's gone, we know it's gone. There's only a 1% chance that cancer will come back there again in 5 years if this is the first time treating it. 5% chance it comes back if it's been treated before. How long have we been here doing this? Since January 2000. We're coming up on 29,000 cases of Mohs surgery that we've done. And where do we do those? We do those mainly on noses, eyelids, ears, and lips, places where you want to save as much tissue as possible, as well as areas on the body where the cancer might be large, over 2 centimeters, almost an inch, or where it's been treated before and come back, or finally, if it has a more aggressive growth pattern, one that's harder to know where the ends are. When you come to the office, make sure that you've allowed about 2 to 4 hours of your day to be here. We never know exactly how long it's going to take to remove a cancer from somebody. When you come in, you'll be seated in the Mohs surgery waiting area, and one of my nurses will bring you back. She will mark the area, you'll confirm it, she'll numb it up, and I'll come in the room. After talking to you, I will then remove as little of your skin as I think necessary to get rid of the cancer. I'll take that piece of tissue, usually cut it in half or 4 pieces, mark it with 2 colors of ink, and then draw a map of it so that when I look under the microscope later, I'll know it was up, down, left, and right on you. I'll take that tissue and bring it into our lab. Meanwhile, my nurse is stopping your bleeding, putting a bandage on, and then you'll wait until I get that tissue back from my lab assistants. When I get the tissue back, I then look under the microscope and see if there's any cancer remaining at the edges or bottom of what I took off of your skin. If there is, I will know exactly where it's remaining on you. My nurse will bring you back into a room, make sure that you are numb, and then I'll cut out a little bit more skin only where the cancer remains. Repeat the process of making slides again for me to look at. That will go on until it's gone. How likely are you to have the cancer gone with the first cut? About 50% of the time it's gone with 1 cut. 50% of the time it takes 2 or more cuts. After the cancer is gone, my nurse will bring you back in a room, clean up the area, and then I will come in and tell you what your options are. First option is always a wound can heal without stitches. About 1 out of 6 wounds heals without stitches. The other 5 out of 6 are put together. I put together the vast majority of those, but about 1 in 25 wounds I refer out to be repaired by a plastic surgeon when I believe that a plastic surgeon can do a better job than I can. Since recording the last version of this video, we now have a plastic surgeon in-house. So most of the cases that go to a plastic surgeon go to Dr. Preston Gardner right here across the hall from me. Sometimes there are other more specialized plastic surgeons, like an eyelid plastic surgeon, that I will refer patients to. Most of the wounds I will put together either by bringing the wound edges side to side in a line, or sometimes I'll do a reconstructive procedure called a flap. A flap is where I have to cut the skin into almost pieces like a jigsaw puzzle to put back together. The benefit of that is when it's put back together, your skin will be the same shape that it was before, especially on an area like the ear or the nose. When using stitches, I always use 2 layers of stitches. There will be stitches on the surface of the skin. They dissolve in about 2 weeks. There will be stitches under the skin, and depending on the body area, they are sometimes bigger or smaller, and they can take anywhere from 2 to 3 or more months to dissolve, but those are under the skin. We will then see you through the wound healing process, either by having you come back in, or by sending photographs, and then advising you. The hardest part of wound healing for any patient is typically patience. It takes time for the wound to either heal or become less noticeable, but they inevitably do. And sometimes there are problems, infections, things just don't heal right, bleeding, and we will help you through those. Anytime surgery is done, there are risks. First of all, there will always be a scar. how much can we hide the scar? And that's always my main goal, is to make it as little noticeable as possible. There's always the risk of pain, and we have recommendations to help you deal with that. 2% chance of a wound infection. If that happens, we treat you with an antibiotic. There's always a small risk of bleeding, and pressure is typically the way to handle that, but we will also give you more detailed instructions when you leave about working with potential bleeding. The day of surgery, we ask you to eat a normal breakfast. That's not going to get in the way of surgery at all, unless you're being referred to a plastic surgeon who's already told you not to eat breakfast. When you come in, please wear a button-down shirt, because if you've got bandages on your face, we don't want to pull those off or jiggle those around any. 2 things I ask you not to do when you come in for surgery. Please don't bring a cell phone into the room that is turned on, because if I am concentrating and operating on you with a sharp instrument and that goes off, it might startle me and I might jump. Also, please don't wear anything with scents to it, like a perfume or aftershave. I am unfortunately sensitive to those, and they give me a migraine headache, and it's best when I'm operating on you that I don't have that kind of headache. If I'm operating below your knee, I'll ask you to bring in a support stocking. A support stocking will provide tension so swelling doesn't happen in the leg. Swelling is the enemy of healing. After surgery, if you have stitches, we ask you to refrain for at least 1 week from any kind of straining, holding your breath and pushing when you're doing something, like you'll do if you're lifting something heavy or bending over. Because when we strain, we sometimes put tension into muscles where the stitches are located, and I'd hate to see those pull apart. My team of skilled and compassionate nurses, as well as my excellent histotechnologists and my schedulers, all look forward to having you here. We have a great deal of experience treating patients just like you. And if after watching this video you're still not sure of something, please give us a call. We will try to satisfy your needs for information or understanding as much as possible. We look forward to seeing you here at Fort Wayne Dermatology Consultants.